WCVB News Center 5 at 7 starts right now.
Attacks on nurses and patient assaults, just some of the problems at the state's flagship mental health treatment center. At 6 o'clock tonight, 5 Investigates told us the facility is designed to give some patients more freedom. But staff members say it's leaving everyone vulnerable, and they told our Kathy Curran about another concern involving safety of both patients and staff.
Every day you come to work hoping and praying that, you don't have to endure such an ordeal again.
Aaron Aiken was brutally beaten by a patient, headbutted and kicked in the face inside the walls of the Worcester Recovery Center and hospital. He's just one of the nurses on edge here.
There's anxiety, just about every night you go in because you don't know what you're going to get.
Bill King was viciously attacked by a different patient. The nurses are speaking out about the violence.
He broke my nose, and I believe it was 5 places. The blood was just everywhere.
The lack of security, training, and proper staffing at what's supposed to be the state's premier $300 million mental health hospital, caring for some of the state's most violent mental health patients. Records obtained by 5 Investigates show physical assaults on staff and patients, sexual abuse, drugs seeping into the hospital, overdoses, and suicides. According to data we requested, there have been 96 assaults with injuries that required medical attention in the past 3 years, almost as many as the 7 other Department of Mental Health treatment centers combined.
Do you think DMH is doing the best it can for the patients?
I think they try to do a very good job, I think. Treatment. Safety is a whole different issue. I mean, it's very hard to treat the patient in an unsafe environment.
If we don't operate safe environments, we can't treat, and people can't get better, and people can't recover. So safety is an issue, huge. Security is an issue.
Commissioner Joan McCullough says new security measures will be in place here come October.
That said, the Department of Mental Health operates hospitals, not prisons. There is more than a fine line between assuring that you have the right security and assuring that you have the kind of appropriate healing space.
Here's another problem. Nurses say at times when they're short-handed, they're forced to pull unqualified staff from housekeeping and the kitchen to help care for and monitor the patients here.
That is just a disaster waiting to happen. So they would, if they can't find staff anywhere, then whoever's available, and sometimes it's just rather unfortunate that whoever is available may be a housekeeper or a KitchenAid.
When you look at the options, Kathy, that it's either run short or run with somebody who doesn't have maybe the proper training, where do you go?
This is the first time that I have ever heard that. I would be surprised if that's accurate. I can assure you that when I leave our interview and have some time later today, I'm going to check in on that.
And the commissioner did check on that and tells us those workers undergo the same training as basic mental health workers before they fill in, and that this practice is used only as a last resort. Nurses say the people who fill in don't have the day-to-day experience needed to do the job, and that puts everyone at risk. Kathy Curran, 5 Investigates.
Thank you, Kathy.